I'm Beverly Kirk with the Global Health Policy Center here with Dr. Kavita Berger. She is the Associate Director of the Center for Science, Technology, and Security Policy at the American Association for the Advancement of Science. And thank you so much for being here to talk about the newly launched Global Health Security Agenda.
Thank you for having me.
How can science and technology, those two communities, play a role in this new Global Health Security Agenda?
The science and technology community is actually a very diverse community. They're the microbiologists, infectious disease specialists. It includes engineers and physicists and chemists, a whole wide range of natural scientists and technologists, social scientists, and even practitioners. And the tools that are developed, the information we know about how the system of science is conducted, the environment in which science is done, and the ways in which these tools can be translated over into practice are all ways in which the S&T community can contribute to the Global Health Security Agenda.
You've spoken about data sharing. How important is that in terms of things like disease surveillance?
So data sharing is a very interesting topic because, of course, we've had a lot of recent history about sharing of sequence information with certain countries around the world, and have taken international sort of steps to address those challenges. But we also have a situation in which questions about sharing data raise security concerns in ways that maybe we would not have predicted a few years ago. But ultimately, sharing of data about what viruses or bacteria or other types of microbes are out there so that we can rapidly identify what strain it is that we're sort of dealing with, and to be able to take those and then make vaccines and drugs to be able to respond will be very, very important. And now we've got tools like crowdsourcing and cloud, sharing through the cloud, and various other tools like that that can help us.
You alluded to security, and you've talked about the importance of security groups. Can you explain how they may be tied to this Global Health Security Agenda?
Well, the Global Health Security Agenda, of course, brings together security and health, but it also brings together other equities, as in the S&T and policymaking communities. And what we've seen with the security groups is that, for example, within the context of the Biological Weapons Convention, issues related to public health preparedness and response and infectious disease surveillance and laboratory safety and security are all integral parts of the BWC, and all of these different stakeholder groups contribute to not only discussing these topics at that the intersessional meetings as well as the review conference, but also to sort of raise it to the level within the security community that this is an integral part of that particular mission.
All right, Dr. Kavita Berger, thank you so much for being here.
Thank you.